Today is January 7th, 2024. I'm logged into United Healthcare / Oxford patient portal, or member portal to be more precise. As instructed by United Healthcare response, I go to find care and costs, go to medical specialists. For example, I will look at a urologist, right? So we'll search for urologist. We'll search for Dr. Tillum. Here's his profile. So provider ID up to medical care, right? This is his information. Provider group up to medical care, among others. Under services and costs, there are two tabs: illnesses and conditions and procedure and treatments. Illnesses and conditions lists exactly 3 price levels, I guess, and don't provide any information on this page. But let's take an example and go to this office visit. Again, it shows office visits of $231. Does not provide CPT code, so it's not clear if it's a new visit, a follow-up visit, which have different type of CPT codes and different costs, whether this is level 2, 3, or 4 visit. Again, those would be priced differently. And again, the cost is an estimated cost, and it says this is, you're seeing the average cost in your area for this procedure. Because specific provider costs are not available, there are no affiliated providers. This is, of course, not compliant with the federal law. As of January 1st, 2024, health plans are mandated to provide price list pricing, contracted pricing for every CPT code, not just for 500 mandated, but for every CPT code in a searchable manner. The only things that are currently provided are 3 codes. It's not clear what these are for, and 17 procedures, far short of the 500 that are supposed to be provided as of December 31st of last year, and every procedure and visit code that is supposed to be offered as of January 1st, 2024. Right? Again, there is no option to search by CPT code, or even to figure out what does this mean. What is this enlarged prostate BPH? Is this a surgery, a procedure? What is this exactly? Right? A visit? It says office visit 137. It's not clear whether it's a new patient visit, a follow-up visit, level 1, 2, 3, or 4. It's totally devoid of meaning and devoid of usefulness. Now, bladder biopsy. There are different types of codes for bladder biopsy. There is a small tumor, large tumor. There is biopsy with fulguration, without fulguration, small lesion biopsy. At least 6-7 codes. It is not clear what is this for. A CPT code is not listed. All of these procedures cost different amounts. The office visit is 522. What level code is this? And the follow-up is 196. Again, I would assume this is a new patient visit, but the CPT code is not listed, so it's not clear whether it's a level 2 visit, a level 3 visit, or level 4 visit. But maybe it's a follow-up visit code. Maybe it's a level 4 or 5 follow-up visit code, and this is a lower level follow-up visit code. None of this is clear. None of this is compliant with the federal law. CPT code is not listed, so the patient doesn't know what in the world he or she is expected to pay. Anyway, clearly, this is not an exception to the rule. We're going to go to just random urologist. Let's scroll down like this, random, and click here. Dr. Stephen Berman. So again, he's working for integrative medical professionals, services and costs. Now you have 3 tabs here for some reason. This tab was missing for the other doctor, but for office visits there are only 4 codes, right? There are at least 8 codes for office visits that are available. You know, 5 levels for new patient visits, 4 levels for follow-up patient visits. That's 9. There are also consultation codes and a variety of other codes that are classified as office visits. But anyway, even if we click here, again, CPT code is not listed. It's not clear what the cost is actually. The cost is significant, $656, and it says that it's an average cost. It's not actually a contracted cost. Again, a violation of federal law. Again, the total number of services that are listed with average prices, not even contracted prices, is 3 here, 4 here, and 17 here. It's way too few, even for the requirement for the last year of 500 services listed with contracted prices. But this year, as of January 1st, United Healthcare is supposed to provide pricing for every single service, and none of this is listed here. That's pretty much it. I think this is very clear. Again, cystoscopy example. Again, average in your area, It doesn't actually list contract prices. Doesn't list CPT codes, which makes it impossible to figure out what exactly this is for, and difficult for a patient to compare between different providers or different health plans. For example, if patient has a secondary plan through a spouse, it may be cheaper for them to go to use a provider that accepts the other insurance. But there is no clarity here as to what's going on. Anyway, that's all for now. It's clear that United Healthcare is non-compliant with federal law as of January 7, 2024.